Newsfirst, Newsline with Faraz, Shauketaly.
And a very good evening and welcome to Newsline Live. Our guest today is extremely special, he's extremely important. He's none other than the commander of Sri Lanka's army and the chief of the task force to fight COVID, none other than General Shavendra Silva. Very good evening to you, General, and thank you very much for being on the program.
Good evening, Faraz. Happy to be here.
Thank you. It's wonderful to see you, and I hope we're not taking away from too much of your work. But I think the first question to ask you, General, is why has the figures suddenly gone haywire, and why is it that we seem to have lost the plot? We were doing so well.
Yeah, of course. First of all, let me thank you and also Sirasa for inviting me at an important day, and especially I'm sure that the people should know exactly what is happening. And you're asking me the question, of course, whether where are we at the moment?
Indeed.
And also why the numbers are gone up. Yes. Today is the highest number as of now, over 1,600 positive cases we have found in Sri Lanka. Yes, of course, because you know that if I start how it came like that is better to know.
Yes.
Yeah, of course, although we had the first patient we found in Sri Lanka on the 11th of March 2020, within 1.5 months, like 51 days, we managed to curtail the spread of COVID-19, and thereafter from 30th of April, since till October 4th, we didn't have a single patient. We had a good strategy. We managed to execute that strategy, and also most importantly, the people of this nation, for the first time, they were scared of COVID, didn't know what was COVID, and people behaved. They were disciplined, and people stayed. People listened to all those who gave instructions or guidelines. They did that. So that is why thereafter we did not have any COVID patients. But unfortunately, on the 4th of October, we got a second wave. And of course, with 2 locations at Minuangoda and Paliyagoda Fish Market.
Yeah.
But still, we managed to bring the situation within 1 or 2 months to some level. But unfortunately, with the Christmas season for shopping, partying, going clubs, nights, everything, with all that, January, we had the highest number. It went up to between 700 to 900. But however, March, we managed to bring that back to down, and by April, first week, it was about 150. But then the people, we did not put a lot of restrictions, but we told to be careful. We wanted people to be careful because Sri Lanka can't just think alone on this situation. So we gave guidelines for them to behave during the Sinhala and Tamil New Year period. Although we didn't have a lot of restrictions, we had few restrictions for New Year celebrations and certain events that normally they take, usually it happens in this country. We gave those guidelines, but unfortunately people, I don't have to tell you how people behave during the pre-New Year shopping and during the New Year and after New Year. We all are aware of what happened. So you can bring any strategy. Now, if you think about the world, you can't, although we are an island nation, we can't think about COVID alone. All over it's there. You think the highest number of patients, over 300,000 patients for a day reported in America. But thereafter, that is only 1 day. But now if you see the situation in India, for the last almost 8 days, more than that, it's over 300,000, 360,000. And the deaths, the amount of death that they have. So initially from Wuhan, when it started, from Wuhan it went to the epicenter was somewhere around the western countries, Europe. Then thereafter epicenter with the second wave shifted to America. But now it's in Asia and it's in India right now. So we have to understand we are very close to this place. We have been doing adaptive. You asked the question about whether we have lost the grip. No. We will not lose. Definitely, we have intelligent people of our nation. They stand at the correct time. We know that. But unfortunately, they did not behave. They thought that yes, initially for the last 1 year, the COVID what we experienced was you get COVID. stay for 14 days, 10 days. From 10 days it goes down.
Right.
On the 14th day you come out.
Right.
And our doctors, we are hats off to the doctors, they looked after all the patients, and we have very low number of mortality, and so we have brought the deaths down. So people would have thought during the new year, yes, even if another wave, it's not a big issue. But it is not the case right now. The second the variant that we have right now experienced in Sri Lanka is not very easy. So it's a very fast moving, fast spreading variant that we are experiencing in the country. That is the reason that you asked the question, why?
Yes.
That is the reason that we find that lots of the numbers are going up fast, you see. Fast spreading, then the numbers are going up. So now people must be realizing this is the real situation. Still we find that now last weekend, having COVID more than 500 to 700 COVID cases, but still last weekend some people have organized New Year celebrations last weekend also. So, but we believe that people at least now understand this move forward. So we have not lost the grip. We can bring rules, but as of now, we being a democratic country, by knowing the literacy rate very high in Sri Lanka, people are knowledgeable, and it can bounce back at any time, bring back the situation with their knowledge. People are very cooperating with each other all the time. So with that, yes, last 3-4 days we have gone up. Soon now suddenly it came up and it's going up. It will go up a little more.
It will go up to, you said about 1,600 today.
Today it will go up. Definitely it will go up. You can't expect that to come down tomorrow.
Right.
So normally with the pattern that we have seen in and around the world, I'm sure that this will go up more. And it will go for a few weeks maybe.
But General, how easy is it for you to order a lockdown? If the people are not taking heed of your advice, all these advisories?
No, if lockdown, of course, if we put curfew, people will have to listen. There is ways and means of controlling that.
Yeah.
But so far, the government, even in the second wave, the government of Sri Lanka, His Excellency the President, the Prime Minister and the government and the task force, the strategy that we adopted was that the country should move forward. While moving forward, that we will bring strategies to bring down the numbers of COVID patients. So it had worked out. I mean, one can say that from October, by March, we brought down to 150. It worked. But now it has started. So we will not give up. We will once again use our thing. But as you said, that there's some people say that the lockdown is the only method. It is not the method. Already, you know that in the world there are a lot of countries that have done that for months, and soon after it's open, once again the numbers are going up. So these are one way of doing things, and also country to country specific, that you change the strategies because the way pattern, the way the variant and all things like that. So we at the moment, we are not in a situation where we are going to lock down the country, but we lock down specific areas where the COVID patients we find, or we think that we will get COVID patients. Threatened areas, we immediately go for a isolation, you see. So isolation, you know, as of now, we have actually isolated about 6 police areas and about 44 Gramildari Vasam GS divisions that we have already isolated. So if at all, whenever we require, for the real requirement, not for the sake of just isolation or putting a lockdown.
But it's absolutely essential.
If there is an absolute essential, we can go for that. And also one must understand, we have a massive number of people in this country who are on daily wages.
Yes.
So they have, we have to look after them as well. But it is, we can't only think of health, the other things also will have to move.
So it has to be a bit like a railway track.
Of course, yeah.
Two tracks.
So, yeah, of course. So therefore, we are doing the best that what is suitable will be done.
And General, there's a section of the population who almost expect you to take stern action to control the almost island mentality being displayed by our fellow citizens.
Yeah, stern action means what? The stern action is, one might think that stern action is for a country lockdown. One might think that yes, those who are breaching what is being told to take legal action or put them, arrest them and things like that.
Yeah.
No, we don't have to go. We, as I said, think of the literacy rate of our nation. We have knowledgeable people. People have always been cooperative. Of course, at times like this time, and at times people maybe thought that why not we enjoy after 2 years, we did not have proper New Year. So even that, but that what I mentioned, that people would have thought, yes, this COVID is all right, within 14 days you can come home. Not a big deal. Majority earlier, up to first, second week of April, majority were asymptomatic cases where they did not have any symptoms. So people would have thought it's another thing. So that I believe that is the reason that they, with the both reasons what I told, would have been the reason for people to relax and stay. We can bring taken a bit of stern action, and rules can be brought, things like that. We always believe the people-centric decisions, think of the people, and we should not be like that. We are not like some countries, okay? So I'm sure that we don't have to go for those things. Turn in the sense we should not turn, what we should have is proper strategies, not for the sake of like executing strategies for certain segment of the people who are asking to deviate from this type of things. No, it is not the case. The best possible, sir, we have a great leader in our country. He understands the situation. He has brought the situation within 1 year to this level. Okay, so therefore, we all cooperate. We have great doctors in this country. Our medicals, the ministry and the medical system is great in our country. We have a armed forces who have won a war where some says that we will never win. We have won that. And people, the great people who supported even the war to win, all the support came. And also these people who supported during from last March to April, they are the people who supported, cooperated to bring the situation back to about 150 positive cases, and also between July to from April to October, not a single case because of their how they behaved at that time.
And General, what's the position with foreigners coming here? Maybe the tourism bubble, for example.
Tourism bubble, we don't get much of a than what we expected. We get a few number, and also in the tourist bubble we get also certain dual citizens and things like that. We have got, I think, more than 20,000 people would have come during from the day that we have opened. So that's also on, it's going on. But in the meantime, we have brought repatriation. Initially it was told that we had to bring only 45,000, then again there's another 40,000 is yet to come. Now we have brought over 160,000.
4 times.
Yes.
More than 4 times what was initially
predicted. Yeah, so we have brought over 160,000 people back to the country. Even today we have brought over 1,200. Yesterday also brought 1,300. We have not stopped the repatriation also. Although lots of people call us and say that repatriation should be stopped, you see, because this is an island nation. We have got COVID, even the second wave, now the variant that we have got from outside, not it was here. So lot of talks are there in regard to stopping the repatriation. So far we haven't done that. Still we are trying to manage, but there can be any time where we find that because all these people who are coming will have to be quarantine. So a fair amount of facilities being put for that also. Already we have more than 10,000 people who are getting quarantined in various places in Sri Lanka. These facilities also can be used for whatever the patients, the positive cases. So with even that, the armed forces are doing, the total quarantine system is done by the armed forces. So still we have not stopped. But we might have to reduce the number in coming weeks because even yesterday we had over 50 positive cases from yesterday flight returnees. So that's quite a number, 50. So we can't afford to have any leaks also during this period. So we might have to curtail the number in coming days.
Thank you. Let's take some of these questions. By the way, if you want to send us the questions, it's 0772 300 305. Card on your screen right now. England has turned things around with proper vaccinations, and here the second dose is due and nobody knows if they're going to get it. So it appears, yes, they have lost the plot, but if not the trip, even if they can't keep the people informed.
No, we have been informing unless they have been blind, unless they have been not listening. No one can say that we have not told, either unless they are deaf or not listening to any of the channels. You see, it's very easy to tell things like that. I think it should be fair when you say that we have not informed. Now, even day before yesterday night, we were on one channel. Every morning we are talking in different types of channels. We have been telling this. Now, yes, as you know that countries who went for good type of strategy on vaccination, like even England, then also US, then also China, these countries, their numbers have come down after this vaccination, where it shows even Russia. So these 4 countries, so numbers are coming down. This shows that the vaccination is one main reason to prevent the spread of the COVID-19, not to eradicate COVID. So in Sri Lanka, whoever who had sent you the question should know that out of all countries in the world, within first 50, Sri Lanka managed to get the vaccination, the vaccines to Sri Lanka, AstraZeneca vaccine. Because the great relationship that the Sri Lankan President, His Excellency Gotabaya Rajapaksa has with the Narendra Singh Modi, the Prime Minister of India, we got 500,000 free. Then thereafter what we ordered, we also got another 500,000. So thereafter we got from WHO another 264,000. So far Sri Lankan, out of Sri Lankan people, 925,000 people were given the first vaccination, mainly the health sector, the armed forces, police, and also Colombo. So thereafter, since the vaccination question came up, as whoever who has said that they were not been informed. So far for the second vaccination, we have already got about balance 365,000, which we have already started the second jab going on to.
So the second process is now on the way.
Right now. By today we have vaccinated more than 25,000 so far. So it has to have a period, no. But then about the other thing, about the vaccines, the government of Sri Lanka, the cabinet has given approval for 13 million to purchase from Sputnik vaccines from Russia. So it will come next week. The first lot 25,000, thereafter 200,000. Within about another 2 weeks, we are supposed to get 400,000. Then we are supposed to get 800,000, and another 1.2 million we are supposed to get.
But can these be mixed with the AstraZeneca?
No, this is not, I'm not talking of AstraZeneca. This is another one.
Another one.
Yeah. Then also we have got the Chinese one also. Sinopharm also we have got 600,000 we have in our hand, but we are waiting. Most likely this coming week we will get the approvals for Sinopharm. So once that is when we get the approval, we have used only 500,000. Only 5,000 we have used. The balance is with us out of the 600,000 that will also be used. If your question is in regard to the AstraZeneca, yes, there's a problem in regard to getting the second vaccine from India right at the moment, because you know the situation in India, not specific only for us, it is the situation there. But the government of Sri Lanka, we have the vaccination task force headed by the chief principal staff officer, the chief principal advisor to His Excellency the President, Mr. Lalit Weeratunga. Mr. Lalit Weeratunga heading the committee. So already they are in touch with various other countries, and I'm also a member of that committee. So we hopefully we will get the AstraZeneca from some other place.
Right. So it won't negatively impact the people like me who got the AstraZeneca first job.
Yeah, we are trying to get the AstraZeneca. So hopefully we are hopeful that we will get the AstraZeneca second one also. In case if it is not the case. You yourself
got the AstraZeneca, right?
I got the AstraZeneca. I was the last from Sri Lankan Army, because after giving the frontliners I got my vaccine. But if in case, if we don't get this vaccine, still we have options for that.
Right.
Okay.
So you're working on those options.
Yeah, of course we are working on that.
You'll be glad to know that various messages have come in. One is a statement. Please congratulate and thank the Army Commander and the government for an excellent job they are doing during this difficult time. Thank you for your questions. Let's see if we've got some more. But yes, we've got one. Somebody is saying that when they travel with the 2 jabs into the country, usually you have to stay 1 day and then get a PCR done, and then you can go away the next morning. But some of them are claiming that sometimes the 1 day becomes 2 days.
Yeah, of course, one must understand that most of these people who come with both vaccines, once they come, they are supposed to do a PCR, exit PCR, and until the results are received, that they will have to stay in a hotel for 1 day. But you know that all these things, the PCRs are being done by the private sector.
Yeah.
So they have given us the green light that they will always give within 1 day. They will give the results after 8 hours. It takes about 8 hours, a little more than that.
Right.
They will give it the same day. That is the assurance given to us. With that assurance only, we told the people, okay, once you come, you get the PCR. 1 day you just check into hotel, and you will be sent out. But unfortunately, as you said, we have to be very honest, we have seen some hospitals, private hospitals, they have not done that. So thereby it has gone to the 2nd day. But this situation we can't accept anymore. Even not only that, even the government quarantine, with the government quarantine, we had some delays with one issue in regard to Anuradhapura lab, where we had some technical issues. So with effect yesterday, the government sector exist PCR was taken over by the army. So we are doing the PCR, the exit PCR is done by the army right now. Likewise, even this, what you just mentioned, we are going to take over from next week. So when we say 1 day, we'll make sure that army will do it in 1 day. 1 day is 1 day. So we will definitely do that.
In the same spirit, will Sri Lanka run out of space for quarantine and COVID patients?
For quarantine, no. We have never gone short of space for quarantine. We have been running for 13 months now. Have you ever heard that we are lack of quarantine facilities? No. We have been doing the quarantine facilities done by the Sri Lankan military. So therefore, we will definitely ensure that we will not. We told that we gave our beds, our linen, and we put the people who got quarantine on a bed, and we were sleeping on the floor. That is how we treated our people, and we will make sure that we will never go short of quarantine facilities for the people of our great nation. Plus, you are asking about even the other thing. Yes, of course, we will not allow that to happen. We have always plans, we have strategies. So yes, one must understand even the hospital facilities. These are catered for certain amount of patients. So suddenly this amount of patients are coming, not only Sri Lanka, all over the world. Most of the countries are gone short of beds and things like that. But we will not allow people to sleep on ground. We will make sure that we will manufacture. Already Army has started manufacturing 10,000 beds for hospitals. So already we have created 5,000.
Is there an indication that things are going to get even worse?
No, it is not. It is not that. That is called contingencies. No.
Okay.
So we are military people. We always, the country is on a footing like that. So we never know these. You can't predict the numbers on a situation like we know that the variant that we have got is fast spreading. So why not we be prepared so that we will not work like certain countries that are running short of beds and things like that. So therefore, we are organized people, and we have we have a leader who is organized, well focused, a visionary leader in the country. So we are under him. So the militaries, he is the commander-in-chief of armed forces. So therefore, we have been given instruction by His Excellency the President to ensure that we should have these facilities. So
can't we negotiate with some of the affluent Western governments who have more vaccines than their population and borrow a batch of AstraZeneca vaccines for the use? And also, congratulations on a grand job so far, General. We are counting on you.
Thank you very much for the confidence that whoever has sent that. We appreciate for such comments, but of course, not that we are not negotiating. That is how, since we are negotiating only, the first 500,000 of vaccines came to Sri Lanka free of charge from India. So even WHO, other countries. So right now, you know that there's a big demand for vaccine all over the world, for every country.
Yes.
It is not only for us in Sri Lanka.
Yeah.
So therefore, we are coordinating. Mr. Lalit Veeratunga and his task force is doing that. And the president himself has spoken many times to various countries. That is how we got vaccine, when more than 130 countries in the world did not get a single vaccine. Sri Lanka got this vaccine. One we must appreciate. So we have got it.
The several questions are coming in about what is the plan B in case there's a delay in the AstraZeneca delivery.
Yeah, in case we don't expect that. Hopefully that we should get the AstraZeneca.
But what's your contingency
Yeah, the
plan?
contingency is that this has been already discussed. It will be told in time to come. But there is one option is that according to the doctors, they say that they can have the immune system with one injection, even one injection, they can run for about 6 to 8 months. Now, if you really see this today's situation with one injection, for until about 3 weeks, it may not work like that. Whoever who had taken after 3 weeks, they are basically, it says immune. But people had got COVID, but COVID had not got worse. Their situation is stable. That is how the doctors have briefed. We have got about 100 cases like that in Sri Lanka already.
Yeah.
So we should be all right. But you ask for the options, yes. If at all we don't get, I don't think that it will happen. We are working out. But if at all we don't get, we have other options. We have already discussed. So nothing to worry. People of Sri Lanka, we will not allow you to just go. We will get some other, you will be secure.
My niece arrived from the United States, not mine, but you know, the viewer. All right, my niece arrived from the United States on Tuesday and is stuck in a hotel in Negombo. 3 days later, still no PCR result has come through. There's obviously a problem.
Yes, obviously a problem. That is with the both doses. Has he or she had mentioned?
Not
if he had not taken both vaccines, then of course not only 3 days, he'll have to stay for 7 days.
Right.
Okay. That is the rule of the nation for COVID. So I'm sure that people who come back to Sri Lanka are aware of what are the procedures for COVID here, what is the procedure for quarantine. So I'm sure, but in case if this particular person is referring with both vaccines, of course, the thing what you mentioned earlier in regard to the delay in PCR. So maybe some private hospital has not done that, although they have agreed to give within 24. That is the reason I told that from next week we will take over and we will ensure that they go within 24 hours.
So that these delays in the PCR...
No, it will not happen in the future.
Right. And there you go. You've heard it from the commander of Sri Lanka's army and the chief of the COVID task force. As we come towards the end, let me ask you, General, what about, we spoke about the beds, you've got a contingency plan for that. What about oxygen?
Oxygen, you see that there are two main suppliers of oxygen to Sri Lanka. So we have contacted them. This morning also I contacted the main suppliers of oxygen to Sri Lanka, especially the health sector. So they confirmed that they are not running short. They are quite confident that they can give. There are difficulties with certain ships that the things are being brought, are being diverted to India mostly. So things like that are happening. These are not easy sailing. It's everything is difficult because there's a massive competition now around the world, especially this part of the world. So India is near and they are running short of lot of stuff there. So they are asking. So that is situation is there, but we are confident according to Health Ministry. They say we have sufficient oxygen, and also the suppliers, both main suppliers, say that they are confident in providing us.
Now then, this is really the last question because we're about to go finish. General, what is the message to the people of Sri Lanka?
The message is that we can bring any strategy. First of all, once again, we thank the people of this great nation who have cooperated with us at the time that we need. Hour of need, people have been standing with us. But unfortunately, yes, something would have gone wrong. People thought that it's easy. People wanted to enjoy after 1.5 years or 2 years with the April incident in 2019. So people went like that, but unfortunately the virus variant was little different and we are facing some situation. Yes, it is the people who we can bring any strategy. At the end of the day, people are the people should bring the victory to this situation. So all what you need is very few things: the mask, social distancing, and the cleanliness. So
right.
yeah,
like that.
Yeah. So what I believe is that we are still not late. We will face some situation for coming few weeks, definitely, no doubt about it. But if people, every citizen of this nation, at least think that now today we have got over 1,600, situation is not as easy, not good. So therefore, everybody should be self-disciplined to see that you or me, I won't get COVID. Then I can handle my family before going beyond. If we can ensure that your family is not getting COVID, for that there are medical advices given as to how you get.
So bottom line is, it's the people's power.
People's power, self-discipline. Self-discipline will definitely bring COVID out of Sri Lanka.
Wonderful. General Shavendra Silva, thank you very much for being on Newsline Live. It's now time for the prime time news, and we're joining Tarusha, and so it's over to you, Tarusha, with the prime time news.